Morning, Thursday, November 2nd. I've been talking about anti-Semitism, and today I'm going to talk about something entirely different. Equally bad. What I'm talking about today is the cost of health care. I'm not an expert in this particular field, but for 7 or 8 years when I was working, I was in charge of getting health care plans for the company. And I can tell you that almost every year I had to change the coverage, because every single year there would be an increase. I would bring on some new company to give us our health care benefits, and they would give me a good deal. But then a year later, they wanted to double the price, or 40% more. And when I asked them why are they doubling the price, they would tell me because we had claims. I said, well, of course we have claims. We had a company that had 300 employees. You expect them not to have claims? And the interesting thing was only about half of the people carried health care in my company because their spouses carried health care with another company. So we were insuring about 150 people, and every year the health care companies would come back and say we had too many claims. But in any event, I would then immediately get on the phone and call another healthcare organization and start the whole routine over again and got a reasonable price. And I did that for 6 or 7 years in a row. So in addition to managing the cost of the health insurance, my company paid 65% of the premiums for the employees. Article that I'm reading today about the out-of-pocket cost for care is a very interesting article in a sense that because of my business experience and my managing the healthcare for my company, how healthcare providers constantly raise their prices. And believe it or not, I had people in the company that were very unhappy when I would change plans. Even though it was costing them more money, they liked Blue Cross or they liked some other plan that we came across. You can't satisfy everybody, but I did the job and I saved the company plenty of money doing that. Now, in what's happening right now, the cost of job-based health care coverage is going to see a very high rise in 2024 due to the stubbornly high inflation. That's what the benefit consultants are saying. They're blaming it on the stubbornly high inflation. And I know better than that because they will raise health care at the drop of a hat. If there's any way that they can raise the price, they will do that. And it's amazing that we in the United States pay double what most of the other countries charge their people for health care. Now, it's expected that companies plan to shoulder most of the increase. But many workers could also feel the pinch in the forms of higher premiums. And I believe that companies are not going to shoulder most of the increase, because it all depends on how it's going to be structured. And healthcare benefits, when the company is paying for it, is a business expense. So they're going to get a tax break. So maybe they will shoulder most of the increase. But I'm not sure it's going to be that way. And let's say they do shoulder most of the increase, and employees pay 10% or something, or 20%. Well, maybe the guys who write these articles think that's not a lot of money. But it could be a lot of money for a lot of people who are earning barely minimum wage and things like that. So as it stands right now, the workers will learn just how much they have to pay during the employer's open enrollment period, which typically takes place about this time of year. So this year, employees are shelling out an average of $6,575 for their share of the almost $24,000 annual premium for a family policy, and just over $1,400 for their share of the $8,500 annual cost of single coverage. So look at that. If you're a family, you pay 3 times what a single person pays. Now, I guess that's okay because a family is a wife and at least one child, so $24,000 is okay. And if you have more than one child, I don't think there's a premium on top of that. So this information is provided by the Kaiser Family Foundation. Now, in this country, we have 153 million Americans who have job-based health insurance. And there are multiple reasons why healthcare costs are rising quickly now. This increase is about 8.5% for 2024, and that's nearly double what the increase was last year. So how can things keep going up by that percentage? That's a couple $1,000s every time you turn around. And higher prices, of course, account for the jump in the premium, because everything costs more. Inflation's at its peak, and so the healthcare industry, which activates their price increases at the end of the year, hasn't caught up with what happened during the year. The contracts between insurers and medical providers are usually locked in for a couple of years. So I guess every time there's a big price jump, you get hammered. And even though inflation seems to be going down, the healthcare is growing as medical providers push insurers for larger cost increase to cover the higher cost of wages and supplies that they endured during the last couple of years. They were unable to pass those price increases on to their victims. How's that for a term? The pandemic really threw a monkey wrench into medical care. So Americans are now going back to the doctor and getting the medical care that they avoided during the COVID-19 pandemic. And more workers and their families are contending with chronic and more expensive conditions because of the delay that was taken in healthcare. So there's been a significant uptick in the use of specialty drugs, particularly for weight loss and diabetes. And the average cost per member for these class of drugs has doubled since 2022. So this entire situation with healthcare right now is a disaster for both the employer and the employee. 2023 employers were paying about 5.7% more than they paid in 2022, and it's expected that in 2024 healthcare is going to increase by another 6.4%. And this situation has caused companies to do what I did all the time. Now they're out there seeking bids on their health insurance programs from multiple carriers rather than automatically renewing their contract with their existing employers. They got to find better deals and lower prices. But that's what I did for years and years and years. So what took these people so long to wake up? Complacency, and in many cases people that are in love with their plan and they refuse to look around. But the times are changing. Medical costs are going through the roof. So there'll be many changes this year. Have a great day. Bye.
Thank you.